Okay.
Okay.
Hey, so I'm here with Dr. Juergen Winkler. I'm going to ask a few questions. Thanks for joining us.
My pleasure.
So, what really inspires you to get into functional medicine?
So, I have always had a different mindset in medicine since the beginning. So once I got into medical school, I started realizing that we were in a model in medicine that was not teaching really where the heart of the problem was in terms of people having illnesses and why they got illnesses and how they actually heal. So we learned a very biomedical model. We learned about the body, we learned about the physiology, we learned about the pathology, but no one ever talked about the mind and the control the mind has over the body. And we never really learned how to get a better understanding to the root cause of illness. Okay? So for example, we understand that if you have a sore throat and you have a strep throat, great, you can take penicillin. But why'd you get the strep throat in the first place? So functional medicine takes that little bit of a deeper step and asks ourselves, how did we get to where we are? And what are the multitude of interlocking and intertwining mechanisms that are happening in the body that actually has a core to it, and what is that core? So starting off in medical school, realizing that what we were doing was taking symptoms, putting those symptoms into diagnostic categories and treating based on a diagnostic category. But we overlooked the person in the interim. So I went back and said, hey, we got to look at the person. Why does that person have that disease? And what can we do about that person? Never mind the name you put to it. Why is that person having that disease process? And what can you do to get rid of the disease process and true healing and curing? So I deviated while in medical school into acupuncture. There was a school of acupuncture 20 minutes down the road in Baltimore where I went to medical school. And so I would go there for lectures. I would read books, much to my chagrin, because then I was actually not doing well in my classes, but I wasn't that interested in them as much. But I knew I needed to learn a lot of these things, but it was just volume overload and I wasn't enjoying it. So I can't really learn when I don't enjoy it. So I've had to find something that I enjoy doing so that I would really learn it. And it seems to me that looking at medicine from a different perspective, if medicine were as great as we would like it to be, then people like me wouldn't need to exist because the system had everything in it, and the system doesn't have that. So I was looking for more in the system. So I was in a career and I wanted to finish the career. The worst thing is being a medical school dropout. And I had a military obligation. I did not want to sit around doing non-medical stuff, having military obligation. And I go, I don't want to do that. So I said, I'm going to finish school, I'm going to get through residency. And I actually began enjoying it. Once I started having patient interaction, I could get a better understanding of what we were doing for the patients and just begin to learn. So I just spent time reading outside of medicine, looking at nutrition, looking at hypnosis. It was really fun in the beginning. A lot of hypnosis in the beginning because I thought, hey, there's something in the mind. And it was really cool because the mind has that ability. You could literally stop your bleeding with your mind through hypnosis. So why can't we do that consciously? We can make people go through surgery, under hypnosis and feel no pain. So I actually had fun learning that and doing that and sort of developing the other side of medicine that I thought was more the personal, human side of medicine, the body, mind, and spirit component of medicine. So that actually became far more intriguing to learn more of that. So functional medicine, being we're looking for root cause, is why I leaned in that direction. So adding to that, my mother-in-law developed pancreatic cancer in 2004, and she ultimately passed away in 2005. And I said to my wife, I said, hey, there's got to be a better way. And so my goal has always been to look and see, is there a better way in which we care for people? Why do people have chronic illnesses? What can we do to reverse that process? And the body is an incredible mechanism. And so healing is just bringing that to fruition. So it's been kind of an interesting journey, to say the least.
Would you say there are any disadvantages to functional medicine relative to traditional medicine, or is it the other way around? Would you say that the trend is going towards more functional medicine to treat illness?
So the trend is towards more functional medicine. If you actually look around, when I first came out here and started going to functional medicine seminars, they were filled with chiropractors and acupuncturists, and maybe 2 MDs in the room. Now you've got more and more MDs in there. You've got larger groups. You've got, the A4M organization is called the Anti-Aging, American Academy of Anti-Aging. They have hundreds of people in the room's packed.
Yeah.
So there's more and more doctors wanting to learn this stuff because why? They themselves have had personal experiences. Their patients are encouraging them to get more information because the patients are demanding it. They're realizing the limitations of allopathic medicine.
Yeah.
And when you look at a pharmaceutical model, it's symptom, treat.
Yeah.
And everything is an anti. Right? We have high blood pressure,
Yeah.
antihypertensive. We have an infection, an antibiotic.
Yeah.
Right? We have inflammation, anti-inflammatory.
Yeah.
So there's only so much you can do in that realm of anti.
Right.
Okay. So really, what you have to do is get back to the root cause, and I think that's where functional medicine is really getting to more of the heart of the matter. And so new models and new research and literature is being developed to really work that model better. So
as we kind of wrap up, what career advice would you give me or any other pre-med student wanting to practice functional medicine but maybe not understanding the path to get there?
Yeah, so the path will kind of illuminate itself as you go along your way. So first, obviously, you got to get through medical school. And I probably wouldn't have you spend so much time distracting yourself from some of the things that I was distracted by, because you just got to learn that really well.
Right.
Once you learn that, then you get into residency, and then you're going to go, well, hey, I still have this core interest in learning more. That's when you start having a little bit more time.
Okay.
And also as you begin to start talking to people, start listening with an ear of intent to understand. And the people, if you listen long enough, they will tell you what the problem is.
Okay.
You don't have to do a diagnostic test. You just listen. They'll tell you what the problem is. Sometimes I'll start an interview and say, tell me your story. And in that story is the answer. Oh, I know why you have this problem. Oh, I get it. Oh, hey, wait, can you talk more about this particular event when you were 6 or 7 years old? What was happening back then?
Yeah.
Hey, there's a pattern of that in your life, right? There's certain things that are happening over and over again. And so the patients are sitting there going, huh, I never thought about that. But they're learning more about themselves. And that's really, really a key point, is to understand the self-awareness and self-understanding, which makes a big difference.
Well, thank you for just expanding my mind,
Oh, my pleasure.
dropping some wisdom and education. And
My pleasure.
Thank you. Dr. Juergen Winkler in the house.
All right.
Thank you.
Thank you.